So if you remember yesterday I talked about, or was it yesterday? I talked about the fact that CPR does not restart the heart. It's only going to help you manually perform. It's going to help the victim heart to manually carry out its work. So what's going to restart the heart is the automatic external defibrillator. AED for short. Automatic external is an external defibrillator. AED, automatic external defibrillator. And if you've watched the movie, you see maybe someone is dying. They just put the person on. They just put it on the person's chest, and the person will just come up. So we don't expect that a common man in Nigeria should have it. Should have this. It is hospital or healthcare system that have this. That's why I said once that person is not breathing, ensure you call for medical advice. And that's why you call a chemist in your street to call the hospital. Although we don't have any safety line or emergency line in Nigeria, but just make sure you just get across to an health practitioner and tell them what is wrong so they can know what to come with. So it is expected that they come with an automatic external defibrillator so that you see once it's placed on the person's chest, there's a way it's always placed, but that one is not we will not learn that here. Once it's placed, the heart is going to restart. So the person is going to become conscious. Don't forget the person was unconscious. So once they place on the person is expected to become conscious. And thing is, an individual needs just an individual this defibrillator should be used just 3 times on an individual. By the third time, if the individual is not coming up, that means the person is most likely dead. So first time is not coming up, second time is not coming up, then third time at least it should come up. That's if the heart has not stopped beating for so long. Remember I told you that if the heart stops beating for so long and the cells and tissues do not receive oxygen for about 10 minutes, the person can die. So, but if you started CPR before 10 minutes, and you can still help the heart to keep working, to keep it alive till the defibrillator arrives, so they can just use it to restart the heart, and the heart will be able to automatically carry out its function without any manual assistance, without any assistance whatsoever. So now, please, I want us to take note of this. And then I mentioned 30 chest compression followed by 2 rescue breaths. That's considered as one cycle. If you want to do rescue breaths, mouth to mouth CPR. After you've done 30 chest compression, give 2 breaths. Continue again 30. But don't forget, you have to push at the rate of 100 to 120 compression per minute. This is very important. Don't push too slow. Don't push too fast. It has to be within this range. If it's lower than this range, that means you are pushing too slow. If it's higher than this range, that means you are pushing too fast. And if you are pushing slightly too, the blood will not come out fully. So please don't push slightly. Remember that's why I said don't push only with your arm. Use your whole body. Then also push deep, at least 5 centimeter. At least 5 centimeter. Then continue to give CPR until the patient exhibits signs of life. This is very important. Continue to give CPR until the patient exhibits. Don't stop. Even if you are tired, please find someone that can take over from you until the patient exhibits signs of life, or until a medical practitioner comes around, or until medical aid is available. So please don't stop. Just continue. Yeah. So the process described is for adults. So I'll be sending a VN to describe the process for children. It's the same thing, just that when, let me show you. Unlike here, where you have to put your hands for the chest compression region, where you have to put your hands, the 2 hands on the chest. In a baby, you're not going to put the 2 hands, you're going to use just finger. You can use just 2 of your fingers, depending on how old the baby is. You can't just exert so much pressure on the baby's rib or the baby's chest region, so you're not gonna break the baby's rib. So just use 2 fingers, just 2 fingers to press the baby's chest. And for the baby, after you've done 30 chest compression, you will give 5 rescue breaths. Unlike in in adults, where you give 30 chest compression and 2 rescue. This is because oftentimes the main cause of cardiac arrest in babies is actually lack of oxygen. So that's why you have to give more oxygen, but still the same 30 chest compression. So 30 chest compression, 5 rescue breaths. Continue again, 30 chest, 5 everywhere. Don't use your two hands, just use two fingers on just one of your hand, two fingers, and don't press too hard, so that you're not gonna break the baby's ribs. So thank you. We've come to the end of this training. If you have any question, please, I would like you to send them in as soon as possible. Thank you.